Good morning. I'm Laval Miller-Wilson. I direct the Pennsylvania Health Law Project. Welcome to the session on understanding Pennie and the new state health insurance exchange. I'm pleased to have my Maripat Pileggi from Community Legal Services join me. And together, we're gonna spend a little time this morning just giving you a sense as to how the exchange works. I'm gonna give an overview about how the exchange, how we got to where we're at. And Maripat's going to go into, in the second half, a bit more details about how it works, and especially how it's relevant to legal aid attorneys and the clients and the low-income clients that we serve, and how it interfaces with Medicaid and the Children's Health Insurance Program. So that's what's on tap. I have to give one disclaimer in that I'm familiar with Pennie in a number of different ways. I certainly followed the creation of state-based marketplace, but I also serve on the board as a member of the authority of the Pennsylvania Health Insurance Exchange, which is called now Pennie, and was appointed by Senator Jay Costa from the Pittsburgh area. So I don't mean to necessarily be defensive about it. It's got a lot of work to be done, but it's also been a tremendous lift in terms of getting it to where we're at. Last piece, before I throw it over to Maripat to see if you had anything to add, Maripat, before we go forward, is we're going to take questions as we go. And Kelly's going to be on, and Maripat's, of course, on with me. And they'll be checking the chat feature. And so we'll take questions through the chat feature instead of opening up for all 50 of us that are on. So please use the chat feature, and I'll pause and Maripat will pause to take a look at questions as we go through. Does that sound about right?
Sounds right to me.
Anything else you wanted to add, Maripat, before I plunge in?
I don't think so. In case folks don't know, there are a few handouts in the scheduling app that you can take a look at, including these slides.
Yeah, we put together some materials that has an overview of some of the exchange. It has some hyperlinks at the end that we think will be helpful for you. And then we'll reference some of those materials as we go through. Okay. So let me open up with what is Pennie. And again, Pennie is the Pennsylvania Health Insurance State Exchange Portal. Just by way of going way background, it's been 10 years since we had the creation of the Affordable Care Act. And as we know, there's still some Supreme Court battles that are going on about whether it's constitutional or not, that will be heard by the US Supreme Court later this year. But it was created by the Affordable Care Act, and its predecessor is the federally facilitated marketplace, which is still in existence, and which Pennsylvania is still technically a part of, but that is still going to change very soon. The FFM, as a reminder, even though the Affordable Care Act passed in 2010, it was really a big lift for the states to create these marketplaces, these shopping and enrollment services for private health insurance. And the first one, the federal marketplace opened in 2014 with an open enrollment that began in 2013 for folks that may recall. Pennie is the official, or is really on the verge of becoming really officially the state-based marketplace. I hedge on that because the federal government has already said it's fine for you, Pennie, to be the official marketplace, but for the consumer purposes, consumer-facing, open enrollment starts in early November. So we'll share with you those dates, and that really, from the consumer side, is the real start. I'll share with you a little bit more in the next slide about what plans are available, but it's essentially high-quality, essential health benefit plans. And Pennie will be the only source for financial assistance for this kind of coverage. It's serving, in terms of Pennie, who does it serve? It serves the approximately 300,000 Pennsylvanians that already have marketplace coverage. They're going to be transitioning from healthcare.gov, the federal marketplace, to Pennie. And that's a big challenge in terms of making sure all those folks that have the coverage see a seamless transition over to Pennie. Again, I should say, when I say coverage, Pennie's not providing the coverage. It's a marketplace. And there are 9 carriers in the state of Pennsylvania that sell their products for insurance on Pennie, on the marketplace. So those folks that have Independence Blue Cross or Highmark or Geisinger or UPMC, that coverage still stays the same. They are transitioning, though, in terms of the marketplace coverage over to Pennie. So that's a large group. And then the other groups that it's serving includes folks that don't have access to employer-sponsored coverage, which is increasing in COVID times, which is in Pennsylvania. I'll show you a map about this. It's about 600,000 uninsured Pennsylvanians that are eligible for coverage. And then it's also operating a kind of a no wrong door for folks that want to apply for coverage and they're not quite sure whether they have it, should have Medicaid or CHIP. You can still apply through Pennie and get that coverage. I think this is the core part that we want to emphasize, or I wanted to just make sure. What's the difference between Pennie and the federally facilitated marketplace in healthcare.gov? Not a whole lot. It is, in some ways, it still covers essential healthcare benefits. It's the same. It still covers, it's the only place where you can get premium and cost sharing subsidies. There's limits for those plans on deductibles and copays. Here's the big difference between the marketplace and Pennie, as I see it. The online shopping experience should be better. The website should be better, and it's Pennsylvania specific. The customer service center is going to be more robust, and the operators of that are picking up the phone and really are aware of Pennsylvania-based coverage, as opposed to operators that don't necessarily know too much about Pennsylvania coverage. The open enrollment period, as you'll see, is going to be longer, and there's more flexibility, we think, with that. And the in-person navigation and assistance experience is likely to be, in this challenging time where this federal government's been hostile to the marketplace, is likely to be better in terms of more funding, although a challenge with COVID. One note about why did Pennsylvania transition? There are a number of different reasons. It transitioned because Pennsylvania was interested in trying to be more flexible to react to changes. It allows for more local control of the in-person navigation programs. The third bullet point is really one of the biggest reasons, though. The federal government was Pennsylvania was paying about $30 million into the federal facilitated marketplace. And that was a lot of money. And Pennsylvania has an opportunity to save in terms of operational costs, that even though it's running its own exchange, they don't have to give as much money now to the federal government, or they can use some of those funds to plow into what's called a reinsurance program that should keep the cost of the health insurance premiums, because we're still talking about marketplace plans and there are premiums associated with it, low. And so there is really a view that this will save consumers and the state dollars by having the reinsurance program. It's also, I think, over time, I don't think this is going to be right out the gate, that these last 2 bullet points, that the marketplace, the Pennie will be able to foster a bit more competition amongst insurers about better quality plans and challenge plans that if you want to do business on our marketplace, you should be offering this and that. This meaning better behavioral health benefits, better physical health benefits. We're not there yet because we're really trying to make sure we have a viable marketplace with multiple insurers. But it is possible that that over time, Pennie starts to become selective and says, if you want to play on our marketplace, you need to have a certain quality of health insurance that is beyond the bare minimum of essential health benefits. Again, that's not where we're at just yet. The second bullet point is, I think, better oversight and management of the Medicaid churn population. By this, I mean, Pennie's not the state Medicaid agency. It's not the department. That's clearly the Department of Human Services. But what we did find is that people would apply to the federal marketplace, and then it would just kind of disappear at times. They could be Medicaid eligible, they could be marketplace eligible, but the federal marketplace was a bit opaque and didn't share a lot of information with states like Pennsylvania about what happened and what was the fate of applicants to the marketplace. This is going to allow the Pennie, the state-based exchange, and the Medicaid program to talk more about applicants and the fate of their applications and to track it down. Let me just add, before we get to Maripat and talking a bit more about just how this exchange works for the ins and outs of it, let me just say a little bit more, because I think it's important as we're about to jump into Pennie about how we got to this spot. One is noting that I've been around for a while, and it's just stunning how we finally are at this state-based exchange 10 years into after the passage. As a reminder, Governor Corbett had said back in 2012, he flipped in early 2012. He said, okay, we're going to go a state-based exchange. And then essentially for political reasons, he ended up saying, we're going to have the federal government run the exchange. And the Corbett administration then jumped into the lawsuits about challenging the constitutionality of the Affordable Care Act. Another key moment that came up in exchange history is that Pennsylvania, about 5 years ago, was really close to putting together a state-based exchange. It was forced into that position by a case called King versus Burwell. And that was a case in which the subsidies were getting challenged. And for the ability of the federally facilitated marketplace to offer subsidies was an outcome of King versus Burwell. And what ended up happening is, as a contingency, folks may recall, Governor Wolf said, okay, we're going to, if this case is decided and the federal facilitated marketplace is abolished, what's the fate of those 300,000 folks that were in the marketplace? Well, we'd like to go ahead and create our own state-run exchanges so we can protect the subsidies. And so the Wolf administration did a lot of work in 2015 just to be ready for that contingency. The Obama administration at the time even approved Pennsylvania to have a state-run exchange. But fortunately, that case didn't get to that point, and the federally facilitated marketplaces continued. And so, so that was withdrawn. And then finally, we get to this point where last year, it was just across the board bipartisan legislation, including by now Speaker Brian Cutler, who was supportive of a state-based exchange and the creation of a reinsurance program to drive down premiums. It's really pretty incredible for the state to have gotten to this bipartisan point and then a year ago, more than a year ago now, lifted to get the operational apparatus to be ready next month to launch it. This slide just, I don't necessarily want to go too much into the detail on this slide, but just to highlight that some of the enrollment trends that have occurred in the 6 years and to give you a heads up as to what's coming. You can see that Pennsylvania enrollment in the marketplace has gone down. And it's gone down, unfortunately, because of especially since 2016 and really since the Trump administration, because of continual attacks on the Affordable Care Act and on the marketplace. So it launched in 2014. 2015 was the high. 2016 goes down. Part of the reason it went down, this was before Trump came in, but it was partly because Pennsylvania switched from having, folks may recall that we did a Medicaid expansion. And so there was a little bit of challenges from going to those private plans that some of us, especially some of us at CLS and PHLP, may recall about the litigation that associated with that. And so that was a little bit of a hiccup in terms of whether they're marketplace eligible and premium plans. But we certainly got through that. But we saw that really since 2017 and forward, it's continued to go down because of uncertainty about the enrollment. The really short open enrollment period that was significant in 2018, if you just look at that, from November 1st of 2017 to December 15th of 2017, that was it for open enrollment. So it really drove down those numbers in terms of the time. And in 2019, the elimination of the mandate continued to make people say, well, why should I bother? Why should I have this coverage? The marketplaces, let me shift over, actually, and let me jump forward just for the sake of just noting. I want to fast forward to one piece. I want to skip over for a second these COVID-19 slides and get to what the projection is for Pennie. This is where we spend a lot of time, frankly, as a board saying, okay, how many people are going to be enrolling? And this is the forecast. And I put this one slide in about this column about COVID. This is the average monthly in terms of where things are at. It's where we're at right now in calendar year 2020, and it's what we're projecting to see in 2021, next year. And folks are paying close attention to this number to see where it goes. There are some key drivers about enrollment. One is the unemployment forecast, and when people have unemployment, clearly one of the things that has come up has been whether they're applying for marketplace coverage versus Medicaid coverage. With that unemployment insurance, it's been difficult necessarily to go into the Medicaid system, but when it ends and you have no income, then one becomes eligible for unemployment or for Medicaid. But that has been an issue that has affected enrollment now, and we'll see what happens later on this month about whether Congress is allowing more unemployment insurance. The other trend that's come up has been about employer-sponsored retention of coverage. And what we've seen so far, and this is going to be tricky this fall, is most folks that have become newly unemployed have been able to continue to keep employer-sponsored insurance. Again, this is going to be a very tricky time coming into this fall to see whether that continues to be the pattern. But actuarial forecasts that have been put together by consultants of the exchange have noted that a lot of newly employed are still keeping their employer-sponsored insurance and therefore not going to the marketplace, the federally facilitated marketplace, and we'll see whether they come to Pennie. And the other side, the key factor has been about folks leaving the exchange. Even if they come to the exchange, they may not stay on the exchange because of job loss or the loss of unemployment insurance income, then makes them more eligible for Medicaid. So they may be on the exchange or Pennie for a very short period of time, but then they would be eligible to shift over to Medicaid. we're still having to see what happens with COVID. It's really unclear what the impact is going to be on premiums. Sorry, not on premiums, but on enrollment. There's been a number of forecasts that are really detailed that I'm not going to go into much about, but from expecting low turnout to very high, those are things that are occupying the board quite a bit. Last slide, I think, before we go into Maripat for details about how it works, is these critical milestones. I noted before, it took a long time to, and a short time to go ahead and pull this together. But we're really on the verge, as you can see, with the launch of Pennie's website. And we have a link to that in the materials that we provided. The orange, or right around September, is the time that consumers on the exchange, the 300,000, are starting to get information and emails and mailings about the transition from the federally facilitated marketplace to Pennie. Open enrollment begins November 1st and is much longer than the federally facilitated marketplace. It begins November 1st and it goes until January 15th. Just as a note, if you get that coverage, it would start on January 1st. But if you get it on January 10th, you can still get it on January 10th, but the coverage would start on February 1st, not in January. But you have until after the new year to get it. And that coverage would continue through 2021 with the assumption of monthly premium payments during that time. And with that, Maripat's going to say a little bit more about those next milestones. At this point, I'm assuming there really weren't a lot of questions about what I was describing. It was a bit more of an overview. But let me stop to see if there's any clarifications.
We don't have any questions yet, Laval. This is Kelly. For attorneys participating on this session today requesting CLE credit, I am going to launch the first of 2 poll boxes right now. You should have a little box that just popped up on your screen asking you a yes or no question. If you could please click yes or no, that will still count. The box will then close for you, and this will be up for 2 minutes. Thanks, and Maripat, Laval, you're welcome to continue. Thank you.
I'm going to take this opportunity to switch, and I'll start sharing my screen.
I'll stop sharing on my end.
All right. Can you see that? Can you see
I can see yours.
Yes.
Great.
Yep.
Awesome.
Yep. Let me go one more favor, Maripat. I just forgot about that one piece about where the uninsured live.
Yeah.
Just before yours.
Let's. This one.
Yep. Yep. Thanks. Just one note about this. This slide, it's a total of 660,000 folks we have in Pennsylvania that are uninsured. That's the lowest we've ever been as a state. This map, I think, is fairly self-explanatory and folks can see it in the PDF. But 36% of the uninsured population live in 5 counties: Chester, Delaware, Philly, Lancaster, and Montgomery. This map excludes undocumented, uninsured immigrants. So the number is actually much bigger. And those of us that have been eager to have undocumented kids, at least, covered through the CHIP program, this excludes that, that population because they're not eligible for ACA coverage. It's really just a note, and Maripat's going to say more about this, but it's just a note that the target in terms of trying to for Pennie in terms of who it's trying to get covered is keeping that 300,000 that's already in and really trying to reach into the uninsured that are eligible for marketplace coverage. And the Lancaster, just last note, people always kind of look at Lancaster and say, oh, well, you got all those Amish folks there. This chart actually excludes folks that have the German ancestry, which accounts for the Amish. Just for reasons that I'm still trying to understand, Lancaster has a really significant uninsured population that are eligible for marketplace coverage. So a lot of the work that is ahead and the reach to folks is to try and cover this uninsured population and get them signed up. Okay.
Okay, great. So we are going to talk now more about the nuts and bolts of marketplace coverage and Pennie, with the caveat, of course, that none of us have used Pennie yet. Pennie's not up and running quite yet. It will be soon. So a lot of what I'll be sharing with you today is what CLS and PHLP have learned through advocacy with the folks at Pennie who are working really hard to get this up and running over a really short period of time. What we know more about is who is among our clients, among our low-income clients, is likely to need Pennie this year and in future years for health insurance coverage. So when we're thinking about who might need Pennie, I think it's really important to remember that marketplace coverage is just one part of the whole network of public health insurance programs that are available to our clients. The other big options, of course, are Medicare, Medicaid, and CHIP. Really, the only other options are Medicare, Medicaid, and CHIP, the other public health insurance options for our clients. Pennie serves a specific, relatively small portion of our clients by offering them financial help. If they're ineligible for Medicare, Medicaid, or CHIP, Pennie will offer financial help to folks over 138% of the federal poverty line to purchase private health insurance on the marketplace. That financial help comes in two different forms. There are tax credits, advanced premium tax credits, or APTC. You might have heard people shorten that tax credit to that APTC. Those are available to folks between 138 and 400% of the federal poverty line to help folks pay for the monthly premiums for these private health insurance plans. And then there are cost sharing reductions, CSRs available, subsidies available to reduce things like copays and deductibles for people between 138 and 250% of the federal poverty line. So you'll see just by looking at these income thresholds that it's not all of our clients, and for some programs it might be a very small portion of your clients who can access the benefits offered by Pennie. Most of our clients can and should get Medicaid, not marketplace. Medicaid offers a more robust package of health benefits than the marketplace plans do. And Medicaid is, for most people, free. So for people who can get Medicaid, they should, because it's almost always a better deal. Medicaid is available to most people under age 65 with income under 138% of the federal poverty line. It is, of course, also available to people over age 65, just the income counting rules and the income thresholds are different once you're over 65. And of course, most people over age 65 are also eligible for Medicare as their primary health insurance plan. The folks under age 65, under 138% of federal poverty line, are eligible for Medicaid just within the last 5 years, ever since Pennsylvania decided, finally and thankfully, to expand Medicaid. So that group, for the large part, are newly eligible for Medicaid. So folks who have been in legal services for a long time, you might not think of Medicaid as something that's generally available to people under 138% of federal poverty line, because it wasn't for a very long time, but it is now. But, you know, we have this Medicaid expansion that expands Medicaid eligibility to people under 138% of the federal poverty line, but we also have a few Medicaid programs that are available to people over 138% of the federal poverty line too. So for those folks, they will have two options potentially. They could have Medicaid, they could have marketplace coverage. So let's talk a little bit about those folks over 138% of the federal poverty line who, if they can choose Medicaid, should. So these are the folks over 138% of the federal poverty line who can get Medicaid. So some people with disabilities who also work despite their disabilities are potentially eligible for Medicaid. There are these two Medicaid programs for people with disabilities: Healthy Horizons, available to people with disabilities that are expected to last at least 12 months. The income limit is written in the rules as 100% of the federal poverty line, so less than 138, but only half of earnings count. So if somebody's working despite their disability and their only income is their income from work, the effective income limit is more like 200% of the federal poverty line, so higher than 138. Unlike marketplace coverage, there is an asset test for this program, $2,000 for a single person, $3,000 for a couple. MAUD stands for the Medical Assistance for Workers with Disabilities program. It is available to people under age 65 with disabilities who have a job. The job can be as little as 1 hour a week of something that somebody is able to do and that someone else is willing to pay them for. So we have clients whose job is to babysit their grandkids for an hour on Saturdays, or to help their neighbor go to the grocery store once a week. Things like that, something that someone is able to do and that someone else is willing to pay them for. The income limit is really high, 250% of the federal poverty line, and again, only half of earnings count. So for some people, it could be as high as 500% of the federal poverty line, so really, really high income limits when compared to any other program that's out there. But again, there is this asset test of $10,000, and it's not free. It's the one Medicaid program that is not free. People have to pay 5% of their monthly income in premiums for MAUD. But 5% of your monthly income for a full package of Medicaid benefits is pretty much always going to be a better deal than the marketplace coverage that people could get through Pennie. BCCPT is the Breast and Cervical Cancer Prevention and Treatment Program. It is available to folks who are receiving or are in need of breast or cervical cancer treatment. The income limit is 250% of the federal poverty line, and there's no asset test. And then young children and pregnant adults also can get Medicaid up above 138% of the federal poverty line, up to 220% for pregnant people and for infants. And then children up to age 5 have an income limit of 162% of the federal poverty line. And then of course, children up to age 19 who are over Medicaid income limits also have the option of CHIP. Children, I think, are probably the least likely to end up on the marketplace because they have the Medicaid and then after Medicaid, the CHIP option. So that is a brief overview of the main programs available to people over 138% of the federal poverty line. And again, just to reiterate, so this is the group of people who might be thinking, oh, my income is too high for Medicaid. Maybe I should think about checking out Pennie to enroll in marketplace coverage. And that might be the good choice for them, but these are really important programs to think about for that group of people to think about Healthy Horizons, MAUD, BCCPT, think about if they're pregnant or their children. They might have these other good Medicaid or CHIP options available to them before they go to Pennie. There are some special considerations. Yes.
Just one question that came through the chat. This
Yeah.
looked like a good place to note. It was raised, does Pennie use the same formula as the federally facilitated marketplace to determine the amount of tax credits, the APTs, and the subsidies? And I answered in the chat, but thought it would be worth noting, and you correct me if I'm off on this, but it's the same formula, that we're not seeing a difference in terms of that difference between the FFM and Pennie to determine advanced premium tax credits and cost sharings. It's the same plans. There's still platinum, gold, silver, bronze, and how those benefits are delivered and the cost sharing that goes along with those. The benefits are all the same in those plans. Those plans are distinguished by how much cost sharing there is. So all those issues around co-payments for silver plans only are the same in Pennie as they are in the marketplace. So not directly on point with Medicaid, but are the formulas different in terms of getting those APTCs? They're the same.
That's right, yeah. I think the main differences, as Laval noted earlier, will be kind of the consumer experience, the interface with the rest of the world between Pennie and the people who are applying, and then Pennie's communication with the other Pennsylvania health insurance programs like Medicaid and CHIP, which should improve. So now that we have a state-based marketplace where they're more in touch with Pennsylvanians and what is happening here on the ground in Pennsylvania. So getting back to our brief overview here of the Medicaid options that many of our clients have. Wanted to spend just 2 minutes talking about immigrants because these questions around health insurance coverage and which options immigrants have can get very complicated, and I could probably spend a couple hours just talking about that. But just to give you kind of the brief lowdown here, folks like asylees, refugees, Cuban entrants, and people who have had their green cards for at least 5 years have the same Medicaid, CHIP, and marketplace options as US citizens. So what that means for those groups of non-citizens along with US citizens is that they cannot get marketplace subsidies on Pennie if they are under 138% of the federal poverty line. If a US citizen or any of the non-citizens listed here go on to Pennie and apply for coverage, they can purchase plans, but they would have to purchase them at full cost if they're under 138% of the federal poverty line. The reason for that is if you're under 138% of the federal poverty line, you can and should go get Medicaid for free. But there are some groups of immigrants who can't get Medicaid because of what their immigration status is. So there are some groups of immigrants whose status will make it impossible for them to get Medicaid unless they are under age 21, or they are pregnant, or they have very low income. And when I say very low income, I mean very low. It's the income limit doesn't go up much more past 40% of the federal poverty line. This group, this very low income group, are the group of folks who are potentially eligible for state-funded Medicaid. So this is not federal Medicaid, this is state-funded Medicaid. And it's available to a pretty small group of people, but it's very important for that small group of people who can get it. But if for this group of immigrants, if they are not under 21 or they are not pregnant or they can't get state-funded Medicaid, they are the one group of people in the world who can go onto the marketplace and purchase insurance with subsidies, even if they are under 138% of the federal poverty line. And that really confused people for a long time in the early days of the marketplace. It still confuses people today, maybe not so much. But it's really important to keep that in mind. So if you're working with a client that has a lawful status, they're not pregnant, they're not under 21, they don't have very low income, they can still get on the marketplace, purchase insurance with subsidies, even if they're under 138% of the federal poverty line. I listed some examples of those lawful statuses here, but it's a very broad group of immigrants who can do this. Pretty much anybody with any kind of status that allows them to be here for any amount of time, really even people with visitors visas potentially would not have an immigration status problem to accessing subsidies through Pennie. So keep that in mind for your immigrant clients. So who are we left with? Who should go on to Pennie within our orbit, within our world of low-income clients at our plan programs? Who should go on to Pennie to purchase marketplace insurance? Well, adults who are over 138% of the federal poverty line, but still within your plan income limits, you know, because they're a client of yours. Who are not eligible for Medicare, because if they're eligible for Medicare, they're ineligible for the marketplace coverage. They're not disabled, or they're disabled, but they have assets over $10,000, so they're going to be ineligible for MAUD. And they're not getting or in need of breast or cervical cancer treatment, so they're going to be ineligible for the BCCPT program, and they're not pregnant. Hopefully that distills it easy enough that that's something that you can kind of hold on to think about when you're talking with your clients about Pennie. The other group of folks to keep in mind are immigrants with a lawful status under 138% of the federal poverty line who are ineligible for Medicaid. Those folks also can go on to Pennie to purchase marketplace coverage with those subsidies. I'm going to talk a little bit about what we know about the application process. Again, we don't know a whole lot. We know what Pennie has told us, and we've had many conversations with them, and they're being very forthcoming and working with us in many ways that we appreciate. But because nobody's actually had their hands on this thing yet, it's a little hard to grasp and understand and to know, you know, how it's really going to work. So the first thing to say is that Pennie does the Pennie applications. They don't make eligibility decisions about Medicaid and CHIP. The Pennsylvania Department of Human Services does that. So for Medicaid and CHIP, if those applications can be submitted through Department of Human Services through Compass, and people can enroll in Medicaid or CHIP at any time during the year. There is no open enrollment period. You don't need to worry about special enrollment periods. Just any time during the year, you can go on and apply for this through Compass. And I should say I used the term medical assistance here. Medical assistance is the same as Medicaid. I might even slip and say MA at some point. Just we all of us health advocates kind of switch between those three terms. Which is annoying to people who aren't health advocates, but it's all the same thing. Medicaid, medical assistance, MA, all the same program. This is what the Compass website looks like. So folks can go on there to open up an account and submit an application. Pennie makes determinations about eligibility for those premium tax credits and the cost sharing reductions, and then connects people to marketplace plans so they can enroll in those plans. There is an open enrollment period of November 1, 2020 to January 15, 2021 this year, which Laval already reviewed. And then outside of that open enrollment period, people can only get into a marketplace plan if they are eligible for a special enrollment period. So if somebody experiences a major life change like marriage, or they lose their employer-sponsored coverage, or there's a change in their immigration status that makes them eligible for the first time for marketplace subsidies, they can go on and get a 60-day special enrollment period at that time to enroll in a marketplace plan. This is what the Pennie website looks like. It's up. You can go check it out now and poke around a little bit. There is some useful information up there now, but not everything. They're still putting it all together. Theoretically, there is no wrong door, and this is kind of always been, this is not a Pennie problem, it's always been theoretical. There have always been hiccups in the application kind of handoff process between all of these different application systems. But the goal is that any application submitted through any one of these doors, really through Compass or through Pennie, should result in that person being enrolled in the appropriate health insurance program. So Compass takes the applications that they get, they determine eligibility for Medicaid or for CHIP, but if somebody's income is too high for the Medicaid or the CHIP they've applied for, their application will be sent over to Pennie, and then Pennie will do its assessment of, or its determination of eligibility for financial help for the marketplace. When Pennie receives an application, one of the first things it does is it does this initial assessment of Medicaid eligibility. And if somebody is assessed as potentially Medicaid eligible, Pennie will send that application over to PA/DHS through Compass for a full Medicaid eligibility determination. If somebody is not assessed as eligible, then that person will then move through to the part of the application where Pennie will determine eligibility for financial help. We have a few kind of red flags, things that we're going to be paying attention to during this open enrollment period with the Pennie application process. The folks at Pennie, like I said, are working really hard to make this application process work really well in November. And I believe that their goal really is to make this process of handing off, so to speak, between Medicaid and Pennie work better than it has with the federal marketplace. But they're still working on it, right? So it won't work perfectly this year. So for example, there will be a screen for disability in the Pennie application process, but we're not sure exactly how that's going to look. We don't know if people will understand that they're being screened for disability or why they're being screened for disability. So not clear that will work perfectly. Pennie is not going to screen for resources at all, so it might flag somebody as somebody with a disability and then send them over to DHS for a Medicaid eligibility determination. But if that person has $50,000 in assets, then that whole process will be completely useless, because that person with $50,000 in assets is not going to be eligible for any of the disability Medicaid categories, and they will just get bounced back to Pennie. And perhaps some time will have been wasted in the application process for that person. It appears that Pennie will only be screening for the 138% federal poverty line income screen is really all it's capable of doing at this point. So, if somebody is potentially eligible for MAUD, for example, as a person with a disability who's working, but their income is way above MAUD income limits, they potentially could get sent over to DHS, but then again, it will all be for naught because their income will be too high, just as an example. Pennie will be using federal electronic databases to verify eligibility, but state databases are not being used, which is disappointing. Of course, Pennsylvania Department of Human Services uses both, so they're more capable of verifying behind the scenes that somebody is eligible for Medicaid than Pennie will be able to verify behind the scenes that people are eligible for a PTC. The Pennie application will not be translated this year, which is disappointing. They are working on getting a paper application translated into Spanish before open enrollment, but we have not heard that yet has happened. But the online application will only be in English, which is problematic. What I think, my advice is if you're talking with a client trying to figure out if you should send them to Pennie or to Compass to apply for health insurance this year, if you're really sure that somebody's ineligible for Medicaid, it probably doesn't make sense for them to go to Compass, right? So if you've kind of talked through, they're over 138% of poverty, they're not disabled, they don't need breast or cervical cancer treatment, they're not a pregnant woman, then probably Pennie is the way to go, with the possible exception of folks who only read Spanish. The Compass application is translated in Spanish. And remember, if somebody applies on Compass and they're ineligible for Medicaid, their application will be sent over to Pennie for an eligibility determination for APTC. So maybe for people who read Spanish, that might be a better option this year at least. Outside of open enrollment, people don't, if they have a special enrollment period, you don't want to miss that. So might be a better idea for folks who are potentially eligible for a special enrollment period to start with Pennie after open enrollment is done, rather than Compass. And then just as a reminder, in case it's not clear to folks, people who are currently enrolled in a marketplace plan through the federal marketplace will transition to Pennie this year for their renewals. So that might be a source of confusion for people if they start getting stuff in the mail from some place that they've never heard of before, Pennie. Those folks will need to use Pennie this year to renew their marketplace plan. Application assistance, the Pennsylvania Association of Community Health Centers is the official navigator entity this year for the marketplace. This link here has pulls up a whole list of community health centers and sites throughout the state where enrollment assisters are or will be for open enrollment. The Pennie call center will be operational in early October. I don't think we have a phone number yet for that, but we should soon. And then of course there is an appeal process for people who apply and are denied or have other issues that need to be appealed with their Pennie application. Appeals have to be filed within 90 days. There's a whole lot about this appeal and hearing process that we don't know yet. We are talking, PHLP and CLS are in discussions with Pennie's Office of Legal Counsel, and they've been very cooperative and are working with us, and we'll be working with them actually on some procedural rules for hearings, which are going to be held by the Department of State, which is going to be a whole new thing for us in the health law world. Well, we're used to Department of Human Services Bureau of Hearings and Appeals, so there will be a whole new adjudication process and entity involved that we don't know about yet. So we'll be learning more about that. But Pennie does seem very motivated to get a lot of these settled, and they seem to want to really work with us on a way to make sure that happens. So stay tuned on that. Do we have any more questions in the chat box? I haven't checked it.
Yeah, I checked. Sorry, I checked a bit. I'll just call them out, and I've been typing a couple in. There were questions about what happens if a PA resident goes to healthcare.gov looking for marketplace coverage, the federally facilitated marketplace. The answer would be they're going to get directed to Pennie. Just like if somebody's in California and they go to the federally facilitated marketplace, it's going to say, we can't help you, California runs it. Go to that website, there'll be a link. If you call the federally facilitated marketplace, they're going to say, here's the number to call. That's what should be saying in theory. There's a question about what happens is the call center set up to assist non-English speakers. This is the operational call center. Maripat, my understanding, correct me if I'm wrong, is that the call center has language capacity. That while the application, we have problems with some of the language accessibility of it, the call center itself, they should be equipped to handle applicants that are calling in different languages.
Yeah, I think that's right.
Okay.
Yep.
And then the last piece I'll note is there an opportunity to become a community partner, like with Compass, to have our own web on our own portal? And will we have liaisons to reach out to at Pennie? Do you want to take the first shot at that?
Liaisons is a great idea. And that is one I don't think that we have specifically suggested or talked with them about. But that is a good one. I mean, I think they only have 2 lawyers in their Office of Legal Counsel right now. And both of them, though, have said that they would be happy to talk with legal advocates to settle appeals. That's a little different than having a set list of liaisons. So that's a good suggestion and one we'll take back. I don't know the answer to the first question. I don't know if there's a possibility of becoming a community partner.
There's a possibility of being an assister, and you can be a broker. I tell you, there are plenty of brokers that are out there that are trying to sell insurance. So there's not a shortage of brokers, and that's a big distinction between Medicaid coverage and private health insurance coverage. That there are a lot of brokers that are going to be able to help folks from communities with getting marketplace coverage. There are plenty of willing to get their commissions on this. That's a whole other conversation. Okay, I think we're at 11 o'clock and we really want to be respectful of folks' time. Please feel free to reach out to Maripat or myself or the Health Law Project if you have things. We put that up on the PowerPoint, and we're happy still today to answer questions that we weren't able to get to. But also feel free to reach out to us over time. We're still learning and hope that it works well. We're crossing our fingers that it's launched well.
Wonderful. Thank you so much, Laval and Maripat, for your time today and sharing your information. I'm going to be launching the second of the poll boxes for CLE credit for your participation. If you're an attorney on this webinar and are requesting a CLE credit for your participation, please respond with yes or no right now. I will leave this up for the next 20 seconds, I'll say. And in that 20 seconds, just a last call. If anyone else has any more questions that they'd like to type in the chat box for Laval or Maripat, we may have a moment or so to do that while.
I saw one, Maripat, one's from Margaret O'Leary. Is it anticipated that CAOs or county offices are going to be able to explain the difference between the FFM and Pennie for Medicaid consumers that are confused? Ugh.
Yeah, that of course will be a tough one. Pennie has distributed, I think, a set of FAQs to the county assistance offices for them to have on hand when questions come up. But I'm sure that will be a challenge throughout open enrollment period.
Yeah, I think that's right. I think it's quite likely that this audience is going to be in a better position than county assistance offices, at least initially, to describe some of the differences and even know more basics about what Pennie is compared to some of the folks in the CAOs that have lots of other things that are going on and just don't have the bandwidth to cover it.
Okay, well, thank you so much for joining us today, everyone. Thank you, Laval and Maripat. And everyone have a great day.
Take care, everybody.
Take care.
Bye-bye.
Thanks, Maripat.
Bye.
Thanks, Laval. Bye.